Hello, my name is Brenda, and I am teamed up with Andrea, Roman, and Bianca, and today we will talk about controversies in our career paths. Here is the table of contents. It includes an introduction, followed by the controversy of AI in cybersecurity, AI in psychology, ageism in marketing, education versus experience, and mandated nurse to patient ratios in nursing. And then at the end, there is a Venn diagram. So, in this presentation, we'll explore major controversies affecting our future career paths. Those include cybersecurity, psychology, marketing, and nursing. And we're going to focus on how technology and both social and business ethics intersect to connect all of our majors.
So today, I'm going to be talking about my controversy, and that is job displacement due to AI. So AI is replacing various jobs in the workplace, and the workplace itself is becoming more and more automated. For example, in many retail stores, self-checkout machines are becoming more utilized, and inside warehouse jobs, conveyor belts with very heavy machinery is also being used, and it is becoming harder to apply and get accepted to these jobs because companies are looking for cheaper options in the long run. So my compare and contrast, companies that use self-checkout automated systems only versus companies that have them and employee manned registers do worse, because with companies only having the self-checkout option, it leaves customers, for example, like older people, they don't really want to use the automated self-checkout. The stakeholders would be customers, employees, the company itself, and investors, and they would all be affected by mass changes in the company if anything were to happen. Summarizing consequences with this are employees are losing valuable skills like problem solving, communication, logic, creativity, and active listening. These skills are important to any job because they can assess how you do certain tasks assigned to you and how you handle different scenarios that you are faced with. So for my data visualization, it shows AI impact for the demand of skills, and we can see that it has gone up in the past, and now problem solving is the main skill that is being in demand right now. A call to action would be to help reduce job displacement. If companies went back to the old way and have very minimum self-checkout units, it can reduce the lack of job opportunities and really open up companies to have employees.
AI in psychology is a controversy that will be affecting mental health and its therapy, its programs, everything revolving around it, because AI's growth will be interfering with how things are done in the traditional therapy or in traditional mental health. So to compare, we have the field of cybersecurity. So in psychology, like I said, AI can be used as a substitute for therapy or for journaling, or like people just dumping their emotions or feelings or problems into a chatbot like ChatGPT or Gen AI, which ultimately can lead to people, especially organizations or databases, to have very sensitive information about people which would not be shared otherwise, with the confidentiality and limitations that traditional therapists have. So some of the stakeholders that might have a role in this field would be people who rely on AI for when traditional therapy is inaccessible, which would be users or anyone, like I said, who doesn't have the tools or support accessible to them in their day-to-day basis, and they really need the help. Professional organization or government agencies might also be in need to provide some safety or protection to users. Data scientists and hospitals or clinics testing AI programs would also be stakeholders in this situation. And some of the consequences that we can see with AI, additional to the data privacy and transparency that we already talked about would be the fact that AI provides a lot of sometimes irrelevant or contradictory information, which can be even harmful to some people suffering from some mental health disorders like anxiety or depression. It usually would lead you to contact a professional, but in sometimes people just ask and are told what they want to hear, which ultimately keeps people in a loop, which can be really damaging to the person suffering from these struggles. And for the data visualization chart, we do have a computer science publication about AI, and it shows really how much AI has grown in every single aspect of people's life and like different types of fields, which eventually will reflect on the psychology field as well. It's very important for us and for psychology associations and AI members or owners to start implementing some limits or protection to users as to provide transparency with information storage and in order to keep users' trust and maintain some safety to it.
Okay, so for marketing, I will be discussing the issue of ageism and the ongoing debate of education versus experience. With digitalization increasingly redefining the skill set for most valued in the profession of marketing, younger employees with updated digital experience generally receive a more generous salary than their older, more experienced colleagues. This brings up the ongoing debate of education versus experience within marketing. So, do you really need a degree for this specific major, or role, or job? Some similar career paths include journalism and PR. Okay, so all of these are looking for two new skills, digital skills and adaptability. Just like in marketing, journalism and PR now prioritize digital fluency, so social media analytics and content management. The younger employees have these skill sets and often earn higher salaries than older colleagues who specialize in more traditional older media practices. As for adaptability, like marketing, journalism, and PR professionals frequently update their digital skills by learning new tools or data analysis methods. So it's very hard for the older employees to transition into these newer methods, thus having ageism appear once more in the world of marketing. As for stakeholders, the main important ones are graduated students, because they invest their time and money into these degrees hoping to get an edge into the marketing world. Older marketers, which are the older employees that are often overlooked. Hiring managers, because they are the determinants that either look for education or experience for their company. Marketing industry as a whole, because they keep on changing the credentials, certification, and upskilling. And clients. So, yeah. Consequences. This industry-based pay gap not only reflects changing industry needs, but can also have the danger of reinforcing ageism by undervaluing the work of more experienced professionals. The extent to which this pay gap is fueling the age-related bias is significant, as it not only excludes veteran workers, but it also keeps them static in their grade. As for my figure 1 for data visualization, this graph is actually inspired by one of my sources, by Eleanor Rosen, and it provides historical context about professionalization and like the dramatic shifts that companies are now looking for in people. It fluctuates every decade to meet the supply market of their pool of candidates. The first 2 decades from 1960 to 1980 did not mention these skills being required. It wasn't until later that roughly 27% of advertisements for marketing jobs by the late 1980s had these skills be required for the job because the dramatic shift towards technology. Newer and often younger employees are more likely to have these new skills, so that's why they get picked. Our call to action. So the way I see it, to ethically address this imbalance, firms must look to partner with colleges to implement strategic procedures such as introducing applied knowledge into study programs in the form of work study for younger applicants. And this is not just a solution for younger employees, but this is also for older employees, because the second part is to offer continuous digital skills training for older workers. So this would eliminate the skill gap across generations without perpetuating discriminatory pay systems in the industry for marketing.
One of the biggest controversies in nursing today is the debate over mandated nurse to patient ratios. Unfortunately, in a lot of states, we don't have proper nurse to patient ratios, so there's no laws that limit how many nurses or how many patients there can be for a certain number of nurses. Laws that limit how many patients one nurse can safely care for at a time. Supporters argue these laws protect both nurses and patients by reducing burnout and improving safety. And that would be true, while opponents claim they increase hospital costs and limit flexibility in staffing. And in other healthcare professions, like physician assistants, respiratory therapists, staffing isn't set by law. Hospitals decide how many patients one clinician can handle. Nursing is different because of the constant patient contact and overwork or workload. California is currently the only U.S. state with legally enforced ratios, while other states rely on hospital guidelines or voluntary staffing plans. This contrast shows why nurses often push for legal protections that other fields don't yet have. Stakeholders. The main stakeholders are nurses, patients, hospitals, and policymakers. Nurses want manageable workloads and safe conditions to reduce stress and mistakes. Patients want attentive care and fewer medical errors. Hospitals worry about the cost and logistics of hiring more nurses. Lawmakers must balance public safety with healthcare budgets and workforce shortages. Consequence analysis. When nurse to patient ratios are low, such as in Texas or Arizona, burnout and turnover rates are high and patient satisfaction tends to drop. But in states like Delaware and the District of Columbia, where there are more nurses per 1,000 residents, outcomes are generally better. The controversy matters because it impacts patient survival rate, nurse mental health, and hospital quality of care. Data. In the bar graph, it shows how nurse to patient ratios vary by state in 2025. States like California and Arizona have fewer nurses per 1,000 residents, while Delaware and DC have more. These colors highlight that states with higher ratios provide safer, better quality care, supporting the need of stronger staffing laws nationwide. Call to action. I believe the best way to solve the nurse to patient ratio controversy is addressed by creating fair staff laws that protect both nurses and patients. Way to solve the nurse to patient ratio controversy aims to create a fair staffing laws that I've seen. How overworked nurses struggle to give quality care when they have too many patients at once. To fix this, hospitals should follow safe staffing limits, like California's model, where nurses have a set number of patient. Hospitals should follow safe staffing limits, California's model, where nurses have a set number of patients per shift. I also think technology can help predict patient needs, so schedulers are more balanced. A professional solution for the nurse to patient ratio controversy is to create fair staffing laws that aid patient and nurses.
Okay, now having explored our controversies for our majors, now we're going to look at how they all intersect. So we're going to focus on 3 main points, those being technology, social, and business ethics. In this Venn diagram, we're going to see how they all intersect. So point A is the middle, the core, which are main points in major controversies affecting our future career paths, which we already went through for each one of our majors. Point B is in between social and business ethics. Point B is in the middle because it prioritizes fair labor, inclusion, and human-centered management. An example would be ageism in hiring and the equal opportunities across experience levels in marketing. And then also fair nurse workloads. As for C, it is in between business, ethics, and technology. So both of these value the use of technology responsibly for profit and efficiency without exploitation. This means we can use it to our advantage to assist us but not replace us. So an example would be how the AI-driven marketing analytics or cybersecurity automation that risk job loss, as we stated in the PowerPoints. And point D would be in between social ethics and technology, because they both balance innovation with inclusivity and human welfare. The examples in the PowerPoints were AI replacing human interaction in psychology, and people becoming more dependent on AI, instead of going to people and talking to people as traditional psychology intended, and digital upskilling gaps in marketing. So yeah, that's how these all intersect and examples that were displayed in our presentation. And this is our works cited page, and that's it. That concludes our presentation. Thank you very much, and I hope you learned something.